FPH. Cold. 1. Sharp. A little bit. Vibration. Vibration. Like salty.
Hi, Anais.
Hi.
My name is Dr. Matt. I'm going to do your exam today. Can you please verify your date of birth for me?
It's January 28th, 1992.
Okay, and your last name?
Is Venegas.
Perfect. Alright, so you've been here about a year ago. Tell me, how are you feeling today?
I have a little bit of like a numbness on my arm. It started, I want to say maybe like a week ago. Sometimes it radiates a little bit up to my neck, kind of just depending on like what I'm doing. And then every now and then I feel a little bit of like a tingling sensation, kind of like right here.
Okay. So it's all on the left side.
Yeah. And then the last thing I think that happened was like in my spine, kind of in the back. Kind of felt like a pull.
Okay.
And it's not all the time, it just very recently came up.
Okay. Are you experiencing any pain right now?
A little bit of discomfort.
On a scale of 0 to 10, how would you rate your pain right now?
I'd say maybe like a 3.
Okay. And are you taking any medications?
No.
Have you had any surgeries in the last year?
No.
Any family history of spine disorders or neurological disorders?
No, I mean, my mom experiences some pain every now and then, but she hasn't really been diagnosed with anything.
Okay, so no surgeries. What about injuries? Have you had any accidents lately?
No.
Okay. Alright, it sounds like we need to do a full body sensory exam so that we can find out which nerve is damaged and why you're feeling these sensations. I'm going to go ahead and start with your vital signs. Have you noticed any flu-like symptoms in the last 48 hours?
Just like
Fevers, chills,
body aches a little bit, yeah.
This is going to go on your index finger. I'm going to measure your oxygenation. And hurry, go ahead and relax your arm. And have you had anything to drink in the last hour?
Water.
Okay. Was it cold water?
Just room temperature.
Okay, go ahead and I'll have you keep this under your tongue with your right hand. Perfect. Oxygenation is 99% under room air, which is really good. Heart rate a little bit. No, heart rate is good. 88. Okay, let's go ahead and check that. 96.9. Okay. I'm gonna take this and I'll take your blood pressure. Is it okay if we use this arm? Yes. I'm just gonna open this on the side so that we can. I put the cuff on the upper part of the arm. Go ahead and relax your arm, uncross your legs. Okay, this is gonna go right here. We're just going to listen. Now you're going to feel like a big squeeze. Oops. Blood pressure is 121/60. That's considered normal. Okay, I'm going to check your vision first. Do you wear contacts?
No.
Okay, go ahead and look right here, straight at my nose. Okay. Pupils are round and reactive to light and accommodating. Just going to press down on your eyelid. A little bit of redness. Okay. Go ahead and look right here for me. Perfect. Okay. I'm going to have you cover one eye. And with the other one, go ahead and hold the Snellen chart. I'll have you extend your arm all the way. Actually, let me close this for you. Okay. Can you go ahead and tell me what letter this is?
L.
Okay. Now go ahead and read the first row.
T, F, P, H.
And what color do you see here?
Red.
And here?
Green.
Okay. Go ahead and switch eyes. And we'll do the same thing. Can you read this letter?
H.
Now go ahead and read the whole row.
P, F, T, L.
And what color do you see here?
Green.
And here?
Red.
Okay. Everything looks good there. I'm going to check your cranial nerve. That is related to vision. I'm going to have you look straight behind me at the wall. I'm just going to come very close to your eye and take a look inside. Just try to keep your eyes open. It's perfect. Not seeing anything. So there's no redness on that side. Go ahead and look behind me straight at the wall. I'm not noticing any scratches behind the retina. We can go ahead and move to the ear part. I'm just going to take a look inside your ears to see if there is any inflammation. Okay, I'm going to have you look that way and you can go ahead and relax. Tympanic membrane is broke, right? Not seeing any redness.
I'm not seeing any inflammation here. The tympanic membrane is normal color.
Okay, perfect. So what I'm gonna do now is I'll have you lay down and I'll start from the top part of your head, the crown, and we're going to move down to the legs. Okay. Are you feeling any abnormal sensation around the hairline?
Just a little bit of tingling, but not that much.
I'm noticing a little bit of dry skin. That could increase the sensitivity that you're experiencing. So let's take a look at the skin. You can go ahead and relax your head. Just slowly pressing down. There seems to be a little bit of edema behind the skin. But I do like that it's pretty mobile, not feeling a lot of tightness. Okay, there's a little bit of redness around the crown. But the scalp doesn't seem to be so sensitive. It's mostly around the hairline. So let's go ahead and do a pH test. Doesn't seem to be too acidic, which is normal. I'm not noticing any changes. We can go ahead and do a sensory test. Okay, I'm going to touch you with a cold and a warm object. Go ahead and tell me if you feel this cold or warm.
Cold. Cold. Warm. Cold. I'm not sure. Warm.
Okay. Now I'm going to touch you with 2 or 1 pressure points in the same time. Go ahead and tell me if you feel 2 or 1.
1. 1. 1. 1. 1. 1.
Okay. And does this feel sharp or dull to you?
Sharp. Sharp.
Okay. Go ahead and tell me if you feel this sharp all the way or it stops somewhere.
I think all the way.
Okay. And does this feel sharp as well? What about now?
No.
Okay. Go ahead and tell me if this is dull or sharp.
Dull.
And now?
Dull.
And now?
Dull.
You did mention that these symptoms mostly started on the left side. So I'm gonna be focusing on the left and see exactly what we find. Go ahead and tell me if you feel this puff of air.
No.
What about now?
No.
And now?
A little bit.
Okay. And does this feel sharp or dull?
Dull. Sharp. Dull. 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 Sharp. Sharp.
Okay. Okay, go ahead and tell me if you feel this cold or warm.
Warm.
And now?
Warm.
Okay. Do you feel this pressure or vibration?
Vibration.
Same thing, pressure or vibration.
Vibration.
And now?
Pressure.
Okay. Do you feel this puff of air?
Nope. A little bit. Oh.
And does this feel like a pressure or vibration?
Vibration. 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 Pressure. Pressure. Pressure.
Okay. Go ahead and tell me if you feel this 2 or 1.
1. 1. 1. 1. 1. 1.
And any pain?
A little bit.
Sensitivity?
Closer to the ear.
Okay. Does this feel sharp or dull?
I think dull.
What about now?
Still dull. Dull. Sharp. Dull.
Let's go ahead and take a look at your face. And I'm going to start by palpating first your lymph nodes. We're looking for any tenderness, swelling. Submental lymph nodes are not enlarged. Preauricular lymph nodes are normal size, and postauricular as well. Moving down to the neckline. Neck muscles are soft, non-swollen. Just going to palpate above your clavicle. Is it okay if I open these 2 buttons?
Yes.
Okay. Okay. Clavicle area looks normal. I'm going to palpate your sinuses above your eyes, right in between your eyebrows. Not feeling any tenderness or fluid buildup. And right under your eyes as well. Okay, eyes look symmetric. I'm not noticing any droopiness. Eyebrows are symmetric as well. Okay, let's ahead and do a test. Go ahead and tell me if you feel this pressure or vibration.
Vibration. Vibration. Pressure. Pressure.
Okay. Go ahead and tell me if you feel this cold or warm.
Cold. Cold. Warm. 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 Cold. Cold. Warm.
Does this feel the same as this?
Yes.
And does this feel the same as this?
Yes.
And this, does it feel the same as this?
Yes.
Okay, go ahead and tell me if you feel this 2 or 1 pressure points.
1. 1. 2. 1. 1. 1.
Okay. Go ahead and tell me if you feel this the same as on the other side.
Yes. No.
Okay. How would you describe it?
Kind of raspy.
Okay. What about here?
Softer. Wider.
Okay. Now I'm going to touch you with 2 textures. One is going to feel dull and the other one's going to feel sharp. Go ahead and tell me if this feels sharp or dull to you.
Sharp. Dull.
Okay, so go ahead and tell me which one you feel now.
I'm not sure. I think sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull.
Okay. Go ahead and listen to your heart. Is it okay if I slide the stethoscope under your shirt?
Yes.
I can hear only S1 and S2. No S3, no S4. Going to listen to your neck as well. center. So I'm going to put a piece of paper on your tongue and go ahead and tell me what this tastes like for you, okay? Go ahead and close.
Orange.
Okay. Okay, go ahead and open.
Salty.
Okay. Okay, so now we're going to go with the olfactory nerve. Okay, I'm going to bring it kind of close to your nose. Take a deep breath in through your nose and breathe out. What does that smell like?
Kind of sweet.
What about now?
Like salty. Like sweet, kind of like cinnamon.
Okay. Okay, I'm going to take a look at your abdomen now.
Okay.
Is it okay if I open the gown here? Okay. So I'm just gonna go ahead and listen to your abdomen.
Okay.
Very normal sounds in all four quadrants. Before I palpate, I'm just going to check for any movement. Okay, that's perfectly normal. We're looking for responses that are a little bit out of the spectrum. Okay. So I'm going to touch you with two textures. One is going to feel sharp, the other one is going to be dull. Go ahead and tell me if you feel this sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. 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 Sharp.
sharp, sharp.
Does this feel pressure or vibration?
Vibration, vibration, pressure, pressure.
Okay. Do you feel this on the left or right?
Left, right, 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 left, right, left, left, right.
Okay. Do you feel this 2 or 1 pressure points?
One, one, 1, 2, 1, 2, 1, 1, 1, 1.
Okay. I'm going to slowly palpate. Let me know if you feel any pain.
A little bit of pain there.
Any pain here?
A little bit.
Okay, I'm going to percuss. Okay. Perfect. Just gonna go ahead and close the gown and we'll take a look at your back as well. Okay, nice. I'm going to slowly palpate your back and go to the side that you said you're noticing a little bit of tingling and normal feeling. Seems like it's coming from the scalp region. And maybe there is a nerve that's impinged around the spine. So first we're going to feel the cervical spine, C1 and C2. Then moving down to the thoracic area. Then we have lumbar and all the way to the sacrum. Spine is not deviated, not feeling any scoliosis or lordosis. sounds, not hearing any fluid build up around the lung area. I'm going to listen to your back. Go ahead and take a deep breath in for me and exhale. And again, breathe in and exhale. You can breathe normal. I'm going to listen to the spine for any abnormal microscopic sounds. Go ahead and tell me if you feel this on left or right. Right. Does this feel sharp or dull?
Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Dull. 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 Sharp. Dull.
Okay. Go ahead and tell me if you feel this pressure or vibration.
Vibration.
pressure. Feel the vibration. 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 Pressure. Pressure. Vibration. Okay, I'm going to take some measurements. Looking for asymmetry, something that would indicate inflammation. A little bit of swelling on the left side. We're just going to go ahead and compare. I'm just going to go ahead and close your gap. Okay, I'm going to go ahead and test your lower part of your body. See if the reflexes are a little bit diminished. I'm going to listen and see if there is any movement that we can detect with the microscopic stethoscope. Noticing any pitting edema. Go ahead and tell me if you feel this cold or warm.
Cold. 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 Warm. Warm. Cold. Warm. Cold. 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 Warm. Warm.
Do you feel feel this pressure or vibration?
Vibration.
I don't like this tuning fork. What about now?
Vibration. Vibration. And pressure. Pressure.
Go ahead and tell me if the temperature changes as I'm sliding it down.
A little bit. A little bit.
Okay, to touch it with two textures. One is going to feel sharp, the other one is going to be dull. Go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. 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 Dull. Dull. Sharp. Sharp. Sharp.
Okay, we concluded this exam today. We're going to go ahead and sit back on the table and we're going to discuss the results. Okay, I'm going to go ahead and take my gloves off and we'll talk about the next steps. So you did say that you're having a little bit of sensitivity around the belly area. We're going to go ahead and order some tests so that we can figure out what it is. And I'll prescribe probably some medicines so that it can help with the pain.
Okay.
And do you have any questions for me before we move forward?
How did I do with the exam on like the textures?
So on the back it was good. I'm more concerned about the scalp. We can go ahead and order an MRI just to rule out anything vascular, and we can do some more tests.
Okay.
Okay. Thank you, Anais, for coming in. I'll see you soon.
Okay, thank you.